Our good friend, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. And Joe, you wanted to talk, first of all, about some of these athletes, bowl games, not playing, possibility of injuries. We saw this last year with the
linebacker from UCLA got hurt last year in the bowl season. Never really got a starting spot this year. Struggled all year long with that injury. Even before that, there's a couple examples. We were mentioning Marcus Lattimore from South Carolina a few years ago. Never got the paydays that he would have gotten. And that's a big payday. That's a full career. And that's a really, really big deal and a really big issue going on. And I think we'll see more of it where people in games that really are not the absolute, really the remainder of the games other than the 4 in the bowl championship series are, so to speak, an exhibition to some extent. And these guys looking for a payday, at least one payday in the NFL, this is their whole career. So I can see that on both sides. I know that there was criticism from Ezekiel Elliott. He came out and criticized this group of people for kind of leaving their teammates high and dry at this point. So there's arguments on both sides. But in a sport that is a contact collision sport like football, there are several plays and several types of injuries that can be end of career threatening kind of thing. So slim
I was going to say, I would say 10 to 15%.
If you really got to see the injury rate and in the locker room and who's getting treatment and not, I would say the majority of college athletes are getting injured for sure.
So even lower than that.
Yeah.
So I can understand this.
But there are certain injuries that are, and that's inherent to the sport of football.
Yeah.
Maybe we'd put all the collision sports into a lesser extent. You could say that about lacrosse. You could say it to a lesser extent about hockey, but particularly football. Now let's contrast this, though, Ray, with the guys taking day off, the healthy scratch of the NBA, which also has people scratching their head. Now, LeBron, Kevin Love, Kyrie, before them, the night before it was Marc Gasol in Memphis. He sat out here. And years before that, Popovich started this with several of his guys. So if he sits them out 2 of 82 or 4 games of 82, he's not sitting them out because so much of that fear of a one-time injury that ends their career. This is more for long-term wear and tear on their body. So understanding the difference of reducing the long-term wear and tear over a year so they're healthy at the end of 8 or 9 months of basketball versus one time out on the field can be the end of a career for the sport of football. So the way we bring that back to youth sports, and this is the talk I used to give even as a coach.
Fracture in the thumb, which is a real key, guys. In a basketball player, you kind of need that thumb when you look at the shooting motion and everything. If it is on his, Tony, is it on his shooting hand? Do you know?
Well, it is his right hand.
Okay, so it is his shooting hand.
Yeah.
And I don't know. I know you don't know the bone at this point.
Yeah.
But take us from best case scenario if there's a fracture to worst case scenario.
Yeah, well, it's somewhat encouraging when they say the initial X-ray was inconclusive. So a lot of significant...
Because you would have seen a bad one right away.
A significant fracture would have shown up right away. There's types of fractures that are called avulsion fractures, where you tear the ligament in the hand or thumb, like Tyrell Pryor tore the ligament in his finger. Tearing a ligament that pulls a small piece of bone with it, theoretically a avulsion fracture, where people can be playing in weeks, versus a fracture that would be, for instance, a joint fracture, which possibly some of which would need to be fixed, which could be 6 weeks, 8 weeks, or more than that with a certain fracture. So, yeah, it's going to be important to work that out and see. But another theory that I have about sports, Ray, that we've shared a lot here, it seems like guys who get to camp late, aren't totally in shape with other guys, start to unravel is the term I use a little bit. It's one injury after another, isn't it? So JR gets to camp, his knee is sore. JR plays on the court, he hyperextends. JR is getting the knee better from a hyperextension, and all of a sudden the thumb is a problem. And there are some people that are just not totally in shape with everybody else, and that's kind of one of the issues of a holdout in professional sports.
Boy, I agree with you 100%, Joe. One other thing I wanted to bring up to you, yesterday, it was all over the place, and I found it
kind of thing from a line drive, that should be a pretty near full 100% healing. And so if you say he's fully healed, he's ready to go and spring training. I'm very excited. If you say, what are we going to get with Danny Salazar? I have a major question mark looking over this year because his injuries have been the ones that have been the more wearing down, overload kind of things through time, especially to the throwing arm, elbow, shoulder. And so I would be more concerned going into camp about him than I would be about Carlos Carrasco.
No doubt. Big question mark there, I think.
Big question mark, and very happy to hear on the flip side because there's a lot of people that think Carrasco can be right up there with the big horse Kluber as your 1-2, real close 1-2 punch. And boy, it might have been a different picture if we had a guy like that this year.
I agree. Thanks, Joe. Have a good holiday.
Have a great Christmas. Thanks, Ray.
There you go. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, live in our studio.